Welcome back to my channel. And if you're a new student here, you are also highly welcome. In this lecture, we'll be looking at the muscles in the arm region. Using this image by the side, this is where we have the upper limb. And we know that the upper limb is further subdivided into sub-regions. This is where we have the arm region. And inferior to this region, we have the forearm. And most inferiorly, we have the hand. If you go back to this arm region, which is the upper region of the upper limb, we would be looking at the muscles that are located in this space. And in this lecture, we would be highlighting the origins and also in the insertion sites of this muscle, and also highlighting some important details that you should know as students of anatomy. The arm region are divided into two compartments. We have the anterior compartment, which is made up of 3 muscles, and we have the posterior compartment, which is made up of 2 muscles. In the anterior compartment, we have a collection of muscles that are located in the anterior region. Then if you go more posteriorly behind, we also have muscles that are located in the posterior compartment. We would be looking at each of these muscles, highlighting their specific details. Now, let's drive through the muscles in the anterior compartment. We already highlighted in our previous slide that these muscles are 3 in number. And the first one here is the biceps brachii. Using this image by the side, this is where we have the biceps brachii here highlighted in blue. The second muscle here is the brachialis, and this is what is highlighted here in this image. If you look at the brachialis, you see that it is positioned deep to the biceps brachii. The last muscle here is the coracobrachialis, and this is what is also highlighted here at the superior region. If you look at this muscle, you see that the brachialis and the coracobrachialis muscles are located deep within the anterior compartment of the arm, while the biceps brachii is located superficially. The acronym BBC can be used to easily recollect the names of this muscle. While the first B represents the biceps brachii, the second B represents the brachialis, and the C represents the coracobrachialis. And if you drive deep into the arrangement of this muscle, you see that they take specific pattern. If you look at it, you see that we have 2 deeply embedded muscles, while we have 1 superficially placed muscle. The 2 deep embedded muscles are the brachialis and the coracobrachialis. There is also a pattern by which they are placed around the anterior compartment of the arm. If you look at the brachialis at this inferior region, even though it is deeply embedded, you see it connecting the humerus to the ulna. And this is where it is seen around the distal region of the arm. While if you go to the coracobrachialis, you see that even though it is embedded deep within the anterior compartment of the arm, it is seen to connect the humerus with the coracoid process of the scapula. So you see that one is proximally placed while the other is distally placed. While the last muscle, which is the biceps brachii, is located superficially. And if you drive through into the biceps brachii, you see that it connects the scapula with the radius. And this is where it runs, crossing 2 joints around the upper limb. So you see that there are specific patterns by which these muscles are placed, and it is very important that we highlight this. Let's drive through the next slide here, where we'll be describing first the biceps brachii. The biceps brachii is superficially placed as we have initially highlighted. It is biceps because it has 2 heads. It has the short head and also the long head. If you look at this image by the lower side here, this is where we have the medial side, and this is where we have the lateral side. This is how the body is placed in its anatomical position. So in the medial side here, we have the short head. On the lateral side, we have the long head. So you see that these 2 heads is what forms the biceps brachii. And this is why it is so referred to as the biceps brachii. If you also drive through this muscle, you see that this muscle does not have attachment on the humerus. This is where we have the humerus, and this is the body configuration of the arm region. So we should expect that the muscles in the anterior compartment of the arm will have a form of insertion or origination at this point. But this is not so with the biceps brachii, because it is seen to originate from sub-regions in the scapula, and it is seen to run through the humerus without having any contact or insertion point in the bone. Then finally, you see it inserted on the radius. at this inferior region. So you see that this biceps brachii, even though it is located in the anterior compartment of the ham region, where the humerus is seen to be forming its bony landmark, this muscle is not seen to be inserted on the humerus. So you see it crossing two joints, which are the shoulder joint and also the elbow joint. So now let's drive into the origins and also the insertion points of the short and the long head of the biceps brachii. Don't forget that this is where we have the short head on this medial side, while laterally we have the long head. So for the short head, it is seen to originate from the coracoid process. And this is where we have the coracoid process here at this upper region. The coracoid process is the beak-like extension directed towards the superior region of the glenoid fossa or the glenoid cavity. We already described this in details in our lecture on the scapula. If you've not viewed that lecture, please kindly go and do so. We have the coracoid process as an emergence sliding over the glenoid fossa or the glenoid cavity. And we know that the glenoid fossa or cavity is what receives the head of the humerus. Now, going to the long head of the biceps brachii, the long head of the biceps brachii is seen to originate from the supraglenoid tubercle. And this is where we have the supraglenoid tubercle here, highlighted in yellow. The supraglenoid tubercle is a tubercle that is created around the superior region of the glenoid fossa or the glenoid cavity. We try to use this upper image. This is where we have the short head here, highlighted in green. And you see that there's an emergence from the coracoid process. This region where this arrow is pointing is the coracoid process, while this region where this arrow is pointing at this other end is the acromion. The acromion is an extension from the spine of the scapula. So if you go to the coracoid process in this anterior region, you see that it is a finger-like projection that is seen above the glenoid fossa or the glenoid cavity. This is where we have the glenoid fossa here, where this arrow is pointing, and this is what receives the head of the humerus in the formation of the shoulder joint or the glenohumeral joint. So this is where we have the insertion point of the short head of the biceps brachii, and this is what is harrowed at this point. The long head of the biceps brachii, highlighted here in red, is seen to originate from the supraglenoid tubercle. This is the supraglenoid tubercle here that is highlighted in yellow, and you see that it is a tubercle that is created just above the glenoid fossa or the glenoid cavity. Don't forget that because we have a supraglenoid tubercle, we should expect to have an infraglenoid tubercle. And it is important that we highlight this at this point because we would be referring to this as we go through with this lecture. But at this point, we should know that the origin of the long head of the biceps brachii is from the supraglenoid tubercle. And this is what is shown here in this image. It is also important that we had, because this long head is long in terms of its orientation, it needs a form of support along the path that it originates from. So if you try to use this lower image, this is where we say we have the long head of the biceps brachii. This long head of the biceps brachii, we already established the point where it originates from, which is the supraglenoid tubercle. But after originating from this tubercle, you see that the tendon is seen to run through the bicipital groove. The bicipital groove is an indentation that is created between the lesser and the greater tubercle. We already highlighted this also in our previous lecture on the humerus. If you've not checked up that lecture, please kindly go and do so. There is an indentation or a groove that is created between the greater and the lesser tubercle. And this is what is referred to as the bicipital groove. It is bicipital groove because it accommodates the tendon of the long head of the biceps brachii. Because the orientation of the tendon of the long head of the biceps brachii is long, it is seen to be supported or tapered down by the transverse humeral ligament. This is the transverse humeral ligament here highlighted in blue, helping to hold the tendon of the long head of the biceps brachii muscle in place, because the orientation is actually long and it needs to be protected or supported so that it will not be displaced. And this is the kind of projection that we have around this region. And it is important that we highlight this in case we are asked during examination. So this is the kind of pictures that is exhibited by the long head of the biceps brachii. So after its origination point, the tendon is seen to run through this groove. And of course, it is not just seen to run through this groove, it is also seen to be supported or tapered down by the transverse humeral ligament. This is what holds it in place within this group. As they descend inferiorly, these two heads will unite, and at this inferior region, they form a common tendon. And this is what is harrowed here in black. This common tendon is seen to then insert on the radial tuberosity. This is where we have the radius at the lateral region, and this is where we have the ulna. So we have a tuberosity at the proximal region of the radius, and this is where the tendon of the biceps brachii muscle finally inserts upon. It is also important that we had that around the medial region of this insertion point, the tendon of the biceps brachii muscle is seen to expand at this point, and this is where they are transformed into the fascia of the precipitatal aponeurosis. Don't forget that the precipitatal aponeurosis is like a tent or a covering that is seen to form the roof of the cubital fossa. If you go back to our lecture on the cubital fossa, where we highlighted the structures that form the roof of the cubital fossa, we highlighted that the precipitatal aponeurosis is one of these structures before it is then overlined by the skin. So it is important that we also highlight that the tendon of the biceps brachii muscle at the inferior region, where it inserts on the radial tuberosity, at its medial region, it is seen to further expand to become the precipitatal aponeurosis. And this is what is seen to form the roof of the cubital fossa, in case we are asked during examination. The arterial supply is by the brachial artery. The brachial artery is an emergence from the axillary artery. We know that at the inferior border or region of the teres major muscle, the axillary artery becomes transformed into the brachial artery. And because these muscles are located around the brachium, it is also seen to be supplied by this vessel. While the innervation is by the musculocutaneous nerve. The musculocutaneous nerve is one of the branches from the brachial plexus, and this is what supplies the muscles in the anterior region of the arm. So now let's go to the actions of the biceps brachii muscle. If you look at the pattern by which it originates and also where it finally inserts upon, you see that this muscle is crossing this joint, and this is where it will be exerting its effect on these two joints. So it is seen to exert effect on the elbow joint because it actually crosses the elbow joint before it finally inserts on the radial tuberosity. And it is also seen to have effect on the shoulder joint because the tendon of this muscle is seen to also cross this joint before it finally inserts on the coracoid process, also the supraglenoid tubercle. So for the elbow joint, it is seen to exert flexion and also supination. While in the shoulder joint, it is seen to exert flexion also, adduction and also abduction. Adduction is exerted by the short head of the biceps brachii because it is located more medially. So it's able to exert the function of adduction, where it is able to pull the upper limb closer to the body. While the long head of the biceps brachii is seen to be located more laterally, and this is why it is able to exert the function of abduction, where it is able to take the upper limb away from the body. So you can see that the placement of this muscle also can be used to justify the actions that they exhibit. Now let's go to the second muscle, which is the brachialis muscle. The brachialis muscle is one of the deep muscles that are located in the arm region. Don't forget that in the anterior compartment, we have a superficially placed and also the deeply embedded muscle. We've described the biceps brachii muscle in our previous slide, and this biceps brachii is a superficially placed muscle. So you need to remove the biceps brachii muscle before you would be able to see the brachialis muscle, because it is actually located deep to the biceps brachii, although more inferiorly. So you have this muscle located deep to the biceps brachii, although more distally placed. If you look at this image by the side, this is where we have the brachialis muscle here highlighted in red. You will see that this muscle is actually located more distally. And of course, it is seen to be positioned deep to the biceps brachii muscle. In this image, the biceps brachii muscle has been removed, so we can now see the brachialis. This muscle is seen to originate from the anterior surface of the distal half of the humerus. If you look at it at this point, this is where we have the anterior surface of the humerus. This region specifically tallies with the deltoid tubercle. This is where we have the deltoid tubercle here, harrowed in black. This deltoid tubercle is the insertion point of the deltoid muscle. If you go back to the origin of the deltoid muscle, we know that this muscle originates from the upper part, specifically from the lateral region of the clavicle, the spine, and also the acromion. And after its emergence from this upper region, you see that it forms a rounded contour around the shoulder. And this is where it finally inserts here on the deltoid tubercle, around the lateral surface of the humerus. And this insertion point here that is referred to as the deltoid tubercle tallies with the point of origin of the brachialis muscle, although the brachialis muscle is seen to originate around the anterior surface. So this is what is seen here in this image. And you see that the fibers of the brachialis run distally, and this is where they are finally inserted on the ulnar tuberosity. This is where we have the ulnar at this medial side. Don't forget that the radius is located on the lateral side in anatomical position. So you have a tuberosity that is created around the superior region of the ulnar. And this is where it creates the insertion point for the brachialis muscle. This brachialis muscle is important for us to add that it forms the floor of the cubital fossa. If we go back to our lecture on the cubital fossa, we said that the cubital fossa has a roof and also a floor. We already described in our previous slide that the roof of the cubital fossa is formed by the bicipital aponeurosis. Don't forget that the bicipital aponeurosis is an extension that is formed from the tendon of the biceps brachii muscle at its inferior region. We already highlighted this in details in our previous slide. So the floor of the cubital fossa is formed by the brachialis muscle. And this is what is highlighted here in this image. So you have the cubital fossa, which is a triangular impression or depression that is seen on the anterior surface of the elbow. Don't forget that the floor of the cubital fossa has a bony landmark and also a muscular landmark. The bony background is formed by the inferior region of the humerus and also the proximal regions of the radius and also of the ulnar. And this is then overlined by the muscular background. This muscular background is formed by the brachialis muscle. And this is what is projected here in this image. And this is what is seen to form the floor of the cubital fossa. You can also go and check that lecture up to keep yourself updated. In case you are asked during examination that the floor of the cubital fossa is formed by which of this muscle? It is the brachialis muscle. And this is what is shown here in this image. This muscle is supplied by the brachial artery, the radial recurrent, and also the superior and the inferior collateral arteries. It is also seen to be innervated by the musculocutaneous nerve. There is an additional innervation on its lateral third by the radial nerve. So now let's go to the actions of this muscle. This muscle, because it is seen to only cross the elbow, it will only be exerting its effect around the elbow. So in the elbow, it is seen to exert flexion, and by now we should be able to understand why this is so. We already said that this muscle originates from the anterior surface of the humerus, and it is seen to run across the elbow joint where it is finally inserted on the ulnar tuberosity. So it is important that we know that this muscle crosses only the elbow joint, and this is why it is only able to exert its effect around this region. And the effect that it exerts is the flexion of the elbow. So now let's go to the last muscle, which is the coracobrachialis. The coracobrachialis is the second deeply embedded muscle around the anterior compartment of the arm region. Don't forget that these three muscles, one is superficially placed, while two are deeply embedded. One of the two deeply embedded muscles is the coracobrachialis. We already described the second one in our previous slide, which is the brachialis. So for the coracobrachialis muscle, it is seen to lie deep to the biceps brachii, which by now we should already know, but it is seen to be positioned more proximally. Looking at this image by the side, this is where we have the coracobrachialis here, arrowed in green. You can see that this muscle is positioned at the superior region. And this is what is seen here in this image. It is seen to originate just from its name, from the coracoid process of the scapula. Don't forget that we have a coracoid process, which we say that it is a beak-like emergence that is seen to slide over the glenoid cavity or the glenoid fossa. We already highlighted this coracoid process in our previous slide, where we described it as an insertion point of the short head of the biceps brachii muscle. Don't forget that the short head of the biceps brachii muscle is seen to originate from the coracoid process. This same coracoid process also gives the origination sites of the coracobrachialis. And this is where we have the coracoid process arrowed in blue. And after this emergence from the coracoid process, it is seen to be directed inferiorly, where it is finally inserted on the anterior medial surface of the humerus. And this is what is seen here to be arrowed here also in blue. It's also important that we highlight that the point where it inserts upon also tally with where we have the deltoid tubercle. This is where we have the deltoid tubercle here arrowed in black. Don't forget that the deltoid tubercle also creates the insertion point or site for the deltoid muscle. We already also described this in our previous slide, where we said that the origin of the brachialis tallies with the level of the deltoid tubercle. The insertion point of the coracobrachialis also tallies with the point or the level of the deltoid tubercle. You can see how interesting this is, and it is important that we also highlight this. The coracobrachialis is supplied by the brachial artery. The brachial artery is an emergence or a continuation of the axillary artery, and it is also innervated by the musculocutaneous nerve. You can see that the muscles in the anterior compartment of the arm region are innervated by the musculocutaneous nerve. And it is important that you note this in case you're asked during examination. Now let's go to the actions of this muscle. Don't forget that the coracobrachialis is only seen to cross the shoulder joint. And we should expect that the action would only be directed towards this region. So it is seen to exert flexion of the shoulder joint, and it is also seen to contribute to adduction and also internal rotation. Now let's move to the posterior compartment of the arm region. We've described in detail the different muscular components of the anterior compartment of the arm region. In our previous slide, we highlighted how they originate and also the points where they insert. So in this slide, we would be looking at the muscles in the posterior compartment. We have the triceps brachii muscle in the posterior compartment of the arm region, and this is what is heralded at this point. Then we also have the anconeus. This is the anconeus here, heralded in blue. We'll be taking each of these muscles one after the other and we'll be highlighting the specific regions where they originate and also the points where they are inserted upon. So now let's go to the triceps brachii muscle. The triceps brachii muscle, from the name, it means it has 3 heads. Don't forget that the biceps brachii muscle is biceps because it has 2 heads, which include the short and also the long head. So for the triceps brachii muscle, it has 3 heads, and this includes the medial head, the lateral head, and also the long head. We would be taking each of these heads one after the other and describe their specific origin and insertion point. So for the medial head, if you try to go back to this image by the side, there is a groove that is referred to as the radial groove. This radial groove is a spiral depression that is seen at the posterior region of the humerus. So this landmark is used to establish the point of origins of both the medial and also the lateral heads of the triceps brachii muscle. So let's imagine that this is the radial groove here, highlighted in yellow. At the inferior region or below the radial groove, we have the emergence of the medial head of the triceps brachii muscle. It will not be seen here in this image because this lateral head is already covering over it. While the lateral head is seen to originate or emerge above the radial groove. So this is where we have the radial groove. It means that the lateral head of the triceps brachii muscle will be originating above this groove. And this is what is heralded in blue. And this is why it is covering over the medial head that is seen to emerge below the radial groove. So before we can see the medial head, we need to remove the lateral head. This is what this represents. So it is important for us to know that the medial head of the triceps brachii muscle is embedded deep, while the lateral head is more superficially placed. So this is the basis behind the presentation that is seen here in this image. So this muscle that is seen here on this outer part is the lateral head, because the medial head would have been embedded deep to it because of the pattern by which it originates, which is basically seen to emerge from the inferior region of the radial groove. Then if you go to the last head, which is the long head, this is what is heralded in red. The long head is seen to emerge, originate from the infraglenoid tubercle. Don't forget we described the supraglenoid tubercle in our previous slide when we try to establish the origin of the long head of the biceps brachii muscle. We say that it originates from the supraglenoid tubercle. We also highlighted that for us to have the supraglenoid tubercle, we should expect to have an infraglenoid tubercle, which is the tubercle that is located at the inferior part of the glenoid fossa or the glenoid cavity. And this is what creates the origin site for the long head of the triceps brachii. You can see how interesting this is. So we have the emergence of the long head of the triceps brachii muscle from the infraglenoid tubercle. We try to use this lower image by the side to further illustrate how the long head emerges. This is where we have the long head of the triceps brachii. Don't forget that this is at the posterior region, and you see it originating from the infraglenoid tubercle. And this is what is highlighted here in yellow. Don't forget that it is infra because it is below the glenoid fossa or the glenoid cavity, and it is a tubercle. And this is why it creates the origin point for the long head of the triceps brachii. So you can see how these heads originate, and after their origination distally, you see that they are united to form a common tendon. And this common tendon is finally seen to insert on the olecranon process of the ulna. Don't forget that the superior region of the ulna will have an olecranon process. And this is what creates the insertion site for the common tendon of this muscle. The triceps brachii muscle is primarily supplied by the deep brachial artery. It also receives support or contributory supply from the superior ulnar collateral arteries. The innervation is by the radial nerve. So now, going to the action of this muscle, extension of the arm at the elbow and also at the shoulder joints. Don't forget that this muscle crosses the shoulder joint, and this is specifically its long head, and also crosses the elbow joint, which of course specifically is by the common tendon of this muscle. So you see that the exact effect at the shoulder and also at the elbow, and the effect that they exert is extension. So now going to the last muscle, which is the second muscle that is located in the posterior compartment. This is the anconeus muscle. This anconeus muscle is a small muscle that is triangular in shape, and it is seen at the posterior lateral region around the elbow. So it's seen at the most inferior part of the posterior region of the arm. If you look at this image by the side, this is where we have the anconeus here, arrowed in blue. This muscle is a very small muscle that is located at the inferior part of the posterior arm region. Some tests would not classify anconeus as part of the muscles in the posterior arm region, considering the pattern of its placement. If you look at it, you see that it is seen around the elbow. But because it exerts the same function as the triceps brachii muscle, would be classifying it in this regard. So this muscle is seen to emerge or originate from the lateral epicondyle of the humerus, and finally it's seen to insert on the olecranon process. If you look at this image at this lower side, this is where we have the medial side, this is where we have the lateral side. So you see it emerging from the lateral epicondyle of the humerus, which is a bulge that is created at the inferior region of the humerus, and you see that they are finally inserted on the olecranon process. And this is what is shown here in this image. This is the medial side, as we say, and this is the lateral side. So it is from the lateral epicondyle that they emerge from, and they are finally inserted on the olecranon process. You can see that this muscle is a very small muscle that runs a very short course. And this is where we have the olecranon process, which creates the insertion site or point for this muscle. Don't forget that the olecranon process also gives the insertion point for the common tendon of the heads of the triceps brachii. This muscle is supplied by the posterior interosseous recurrent artery. It is also seen to receive its innervation from the radial nerve. The radial nerve is one of the branches from the brachial plexus. Its action is to extend the arm at elbow. So you see that it also contributes to extension. So in this regard, we are able to also classify it as part of the muscles in the posterior compartment of the arm. It is important that we highlight this, that some tests will classify it as one of the muscles in the posterior compartment of the forearm region. So thanks for watching this video. Let's continue to stay glued to my channel.